Here we go. Well, today I'm with Courtney Klenk. Courtney is a physical therapist in a hospital-based outpatient facility. Courtney, can you tell us how has the COVID virus impacted your position and your role as a physical therapist?
Sure. So I am still in the clinic treating patients. I feel very fortunate to be able to do that. A lot of different changes. I do have a few patients that are doing treatments through telephone calls. So obviously there are some challenges in that, and just being creative in the home exercise program, making sure I'm efficient with the home exercise program. And it's just different not having that face-to-face contact with patients. Another change I'd say is a lot of my staff right now, a lot of my coworkers are furloughed, and everyone in the team, they bring something different to the team. So just missing my team, missing the things that other people bring to the table. Another thing that's changed for me, the hours that I'm not in the clinic, I'm being asked to serve as a screener up at the hospital. So that's different, but I think all of us, or many of us in the PT, as PTs, we want to give to people, we want to help people. So whether that's our patients or whether that's, the team kind of thinking more, broader team, so I'm happy to play that role, but that's been a challenge, that's just to kind of go into that setting. I have done a little bit of training for inpatient, a few hours of training in case I'm needed, in case the numbers get high enough. And again, that's a challenge. I chose outpatient rehab because I feel like that's where I can really show my skills. That's where I thrive. I haven't had to go into the hospital yet, but those are the challenges. Those are the changes because of COVID.
Yeah. What kind of screening are you doing? Is this more to screen if someone potentially has COVID, or what kinds of screening are you involved with?
It's kind of evolved. When I first started, we were asking a lot of questions about symptoms, and now it's just making sure the patients are supposed to be there. The hospital is still doing some procedures, so making sure the patient's supposed to be there, making sure they have a mask, and just kind of guiding them to the right area. Occasionally we'll get some patients that need to be directed to the emergency department. So same thing, just making sure they have a mask on and making sure they get to the area safely.
Well, we appreciate it. It's really nice to see physical therapists' roles evolving and being such an important part in the healthcare delivery. And we're all being challenged in not only how we do that, but how our roles have changed. How are you personally taking care of yourself and managing this?
I'm doing, probably about 2 or 3 years ago, I started, have this family friends, they have a studio, and they do meditation, they do Reiki. So I just make sure that keeping my stress under control. I'm doing some breathing, some yoga, the meditations, some of the Reiki as well. So
Right.
just making sure, I'm taking care of myself so that I can go ahead and take care of others.
Good. What are you looking forward to the most in the future?
Oh, just having that clinic full again. Having that clinic full again, having my team back. And I really, I haven't done any video visits yet. I have some scheduled for next week, and I'm excited for those. And I'm really excited to see how that will continue even after the pandemic. I think the telehealth is going to continue to have a big role in our practice. Another thing I'm really looking forward to, I think this is giving us the opportunity to show the rest of the medical community just our role, and that we do play a role in the community. So I'm hoping that maybe this might open up some doors to take some relief, give the primary care provider some relief. I don't know if it's possible, but if someone has back pain, instead of having to go right to the primary care, maybe more opportunities for direct access. Because once this all clears up, I'm sure they're going to be just inundated with patients just for kind of routine checkups. Another opportunity, any of these patients that are hospitalized, there's going to be an opportunity to help them with deconditioning. So I'm excited on the other side of this to be able to help those patients get back to their normal function.
Well, that's great. And you're looking at some great opportunities that will help our profession and ultimately our communities. Courtney, thank you so much. I wish the best to you and your team, and stay healthy and keep taking care of yourself as well as
You too. Stay well.